Hey, my name is JC. I'm a clinical exercise physiologist and cancer exercise specialist. And today we're going to talk about how to exercise after a mastectomy. Now, there's a couple of things to know because exercising after a mastectomy comes in phases. So there is like a recovery phase, that's between the 6 and 8 weeks right after the surgery. And then there's the post mastectomy phase where you finished your 6 to 8 weeks. Now you're cleared, and then that's kind of like the rebuilding phase. And then you have your actual building phase or your growth phase. So for the recovery phase, that's your 6 to 8 weeks. The first 2 to 3 weeks, you're really focusing on stretching, just making sure you're moving the arms, going up the wall, doing the spider. That's your typical physical therapy exercises. If your oncologist did not refer you to a physical therapist, I strongly recommend that you ask for a referral. Even if they didn't suggest it, it's not practice or maybe common that oncologists refer you to a referral right away. I recommend it because you want to make sure you're maintaining function. You also don't need you need a referral if you're in the hospital, but if you need a referral for a good physical therapist, just let me know in the comments below and I can connect you to one that won't require a doctor's referral. They'll see you, they're oncology trained, and they're incredible. Now, during those, the next 3 to 4 or 5 weeks, that's when you're going to focus more on your mobility, maybe focusing on greater ranges of motion, focusing on some band work for your arms. You're going to take that stretching a little bit further into making sure you're recovering well. You can't add any weights during those 6 to 8 weeks for your upper body. You can still train your lower body. Great exercises to do are lower body exercises that don't require arms. So you wouldn't be doing squatting, you wouldn't be doing any deadlifts either. But you can do leg presses, leg extension, leg curls, calf raises. All those exercises, particularly machines, are great to do to strengthen your legs in that 6 to 8 week time period. Once you're done with those 6 to 8 weeks and now you're cleared, your oncologist is going to tell you you can return to normal and listen to your body. But, what the heck does listening to your body even mean? It means that you're going to have to learn what your body can handle. So if you have a certain pain threshold, everyone has a certain pain threshold that if after a certain amount of reps or after a certain amount of weights or within a certain position you experience pain, you want to work out underneath that threshold. How do you know what that is for you? It's a trial and error. You're going to have to try different exercises. You're going to have to try different weights. What I always recommend is start light, build up from there. That's going to be the safest and the best way to exercise after any surgery once you're cleared. That's going to give you a better idea of what you can and can't do. Now, you can exercise during chemotherapy and radiation. I have a whole video on that, so definitely check that out in my Spotify and in my YouTube if that's easier for you, because I have a full breakdown of what you need to know when exercising during chemo and during radiation. But let's continue with after a mastectomy. Okay, we talked about that recovery phase. Now let's get into the building phase, or the getting ready to get back to normal phase. This is where you are going to start to increase your range of motion and your strength. Now, once your doctor says you are cleared, you want to focus on stretching chest and contracting or working out your upper back. Because what happens after surgery, especially after a mastectomy, two things happen. Number one, the chest gets tight and the upper back muscles get weaker. So the chest gets tight, upper back gets weaker, and that basically increases your risk of injury, lowers your range of motion, creates more aches and pains, and disrupts your quality of life down the road. So you want to stretch the chest, contract the back. With that, great exercises to be doing is a pec stretch, chest flies without any weight. You can do that on a bench. That's going to be best, so you can get a bigger range of motion. Doing Y's, T's, A's, W's. These are all exercises you can look up in my YouTube channel, and you can literally put, how to do a Y raise by JC, and you'll find it. How to do a chest fly by JC, and you'll find it on my YouTube channel. If you don't know what these exercises are, But all these exercises are great to do after a mastectomy once you're in that rebuilding phase. Face pulls are another great exercise to do. Obviously, always start out light and work your way up because we want to strengthen a lot of that upper back. You're going to focus more on pulling rather than pushing. Now, once you get into about 4 to 6 weeks, so an extra 4 to 6 weeks of that rebuilding phase, now you step into the building phase. And in this phase, you're really focusing on really putting on muscle, increasing the strength, adding on some weight. From here, you're still doing the same exercises from the rebuilding phase, the Y's, the T's, the W's, the face pulls, but these are going to be now your warm-up exercises. And that's going to lead you into your actual workout, where you're going to focus more on pulls, on rows, so horizontal pulls and horizontal pushes. Now, you're going to focus on the horizontal first, keeping those elbows close to the rib cage, because the reality is you're probably not going to have any limited range of motion doing those two exercises. Once it comes above the head, that's when it becomes a little bit more challenging to do. So that's why I always recommend keep those elbows nice and tight to the rib cage because you're going to have less disturbances. If you have any, you could always do physical therapy to kind of increase that range of motion above the head. If you have full range of motion, for example, you did your physical therapy, there's nothing stopping you from raising your hands above your head, that's when you're going to start the vertical pressing and vertical pulling. So your lat pull downs, your chin up grip pull downs, wide grip pull downs, prayer pulls, great exercises to be doing for that trap, especially if you have any lymphedema afterward. It helps really move that lymph fluid across your back, which many women have. And it helps with the cording, a lot of the tightness in that underarm. Great exercises for that. And then for your chest, shoulder presses, chest flies, incline presses, incline flies are all incredible exercises to be doing with some light dumbbells to get a good stretch and range of motion, increasing some stretch and some muscle and strength in the chest area. So you don't want to avoid doing chest exercises. You want to include them into your routine, but slowly and steadily. What I just described to you, that's about, let's see, we had that's almost a 5-month period. Let's call it 6 months to, make it an even number, right? Within 6 months, you should be fully returning back to normal. Now, 6 months might sound like a long time, but most cancer survivors don't return to normal after 6 months. It takes 3, 4, 5, 6, 7, some people even 10 years to return back to normal and get their function back because they're not taking the right steps. And the right steps is starting to rebuild your body back up. Is it annoying? Yes. Does it require patience? Yes. Nobody guides you through this. I understand. That's part of the reason why I wanted to build this for you. But I know for a fact because I worked with cancer survivors. All of my online coaching survivors, the clients, they do these exercises and they feel absolutely incredible. I'm not giving you exercises out of random here. I'm giving you exercises that every cancer survivor I've worked with in my online coaching program, they feel incredible doing this. In fact, they're like, wow, I didn't know I could feel this good doing this. The keyword is they tell me I needed to do this and I had no idea. There's nobody really guiding you and giving you this information. So it's important to learn and understand what it is that it takes to really rebuild your body. Many times, online coaching clients are coming to me 4, 5, 6 years down the road, and they could have experienced what they're experiencing now right after treatment or even during treatment. Better yet, they could have been feeling better earlier. But there's just not that information out there. So if you found this helpful, please share it because you don't know who you could be helping in their journey. Now, in terms of returning back to normal, I get asked a lot, can I ever return back to normal? Am I ever going to increase strength? Can I get back to the gym? Yes, you can. I had an online coaching client who she wanted to do push-ups and she wanted to get back to benching and she wanted to do a handstand push-up. She is able to do that after breast cancer, after a mastectomy, because she followed the right steady approach to rebuild strength in the right areas. We didn't just jump straight into trying to do what she did before, right? A lot of times what happens is that without the guidance, people go try it, they get depressed that they can't do it, and then they just kind of give up. What I do is I work through those mental struggles, rebuild slowly, and then before you know it, you're back to where you want to be. Or you're 9 times out of 10, you're surprised about what you're able to accomplish because you have the right guidance and the right support. Something as simple as like, you might not be able to do the handstand push up right now, doesn't mean you won't be able to do it in the future. It's so important for you to know just because you might not be able to achieve whatever that may be for you right now doesn't mean you won't be able to achieve it in the future. So it's very important to know that it is possible to rebuild. It just takes time, and you can do it. Focus on recovering first, rebuilding, and then from that rebuilding phase, that's when you get into that growth phase and you start doing those heavier exercises. Throughout this whole time, you're still working on your legs. Once you get into that rebuilding, you can work on your core a little bit more, doing some anti-flexion, anti-rotation, a lot of standing exercises, and then you just get back into that full body exercise where you're getting those full ranges of motion. And if you ever have any questions, go ahead, please leave them in the comments below. I'm always happy to help. JC, Cancer Exercise Specialist.